Hey everybody, Alyssa here at Preferred Physical Therapy, where we help people age 40 plus stay active and independent, live free from painkillers, and avoid surgery. Today I'm going to talk about why it's important to get treatment for your vertigo or your dizziness. So we found that dizziness is a common patient symptom. Whether it's the primary complaint or a secondary, it's the third most common complaint during a doctor visit, actually. And so it's estimated that 35% of US adults over 40 have had some type of vestibular dysfunction, whether that's the true BPPV, a unilateral or a bilateral vestibular hypofunction, any of those things that can cause just some of that inner ear dysfunction and then translate to issues with your balance and things. And so we always take for granted how easy it is for some of us to just walk across the grass or a really rocky terrain, how easy it is to get up in the middle of the night to go to the bathroom, navigate through small dark areas like a movie theater where maybe we're getting different sensations, we're having less light, all of those things that can contribute to a change and an increased need for our balance to be good. And so it's important that we not only get medical treatment if it's an issue that's coming, from our medications, things like that, but also work on it from a physical therapy or from a functional standpoint where it's not only just, it's inconvenient that I have to have a nightlight or something like that to go to the bathroom, but it's a safety issue where now if you trip and fall, if there's a fracture or anything like that, all those secondary, hopefully avoidable conditions that could happen from having poor balance. And so not only balance, but it's important to integrate some of those other systems. So we'll go into a little bit more depth. I think we're going to have a workshop in the future, hopefully, about this because it seems to affect a lot of older adults. But not only is our inner ear, our vestibular system part of it, but also our eyes or our ocular. And so we do a lot of things here in physical therapy. Also, you'll find that vision therapy, as far as like optometrists and things like that, you do a lot to make sure that our eyes are giving correct input so that way our body knows where it is in space. And so we do exercises like that to help, like especially if you're noticing, when you're in the car and you have to focus on something because you get dizzy when everything's kind of like that motion sick kind of sensation. Or, every time I turn my head, I find that, there's like kind of a wave of maybe not the full on like spinning, but a wave of dizziness. So there's lots of things we can do to help treat these types of conditions. And not only if we can't completely get rid of it, we do techniques that are called habituation, which is basically getting your body used to being in these different positions and teaching it to not react as intensely each time. And so there's tons of things, like I mentioned, treatments wise, really it's kind of based on your imagination how far you can take different balance exercises. So it's definitely something that if you're kind of on the fence about, well, do I have to live with this forever? Can someone help me at least decrease the amount of dizziness or the level of discomfort I feel, the level of hesitation I have with going out and doing things with friends or family because I'm worried I'm going to get dizzy, I might fall, I don't want to be embarrassed that happens. Those are all things that hopefully we as physical therapists or another healthcare provider can help you take care of. And so I definitely would say if it's something that you're considering, if it can help you, it doesn't hurt to ask. So like always, you can reach out to us. You can give us a call, drop a message through our Facebook. You can leave a comment in our YouTube videos. Any of those things, we'll always get back to you. But we'd love to hear from you and see if there's any way we can help you with that dizziness. Thanks. Have a great week.